If someone is bleeding like this, you don't have minutes, you have seconds. I've been on calls with tourniquets made the difference between life and death. Massive bleeding is one of the fastest way somebody can die. And most people hesitate because they don't know what they're looking at. You have three different types of bleeding. Bleeding that comes from your capillaries, bleeding that comes from your veins, and bleeding that comes from your arteries. Capillary bleed comes from something similar to falling off a bike and scraping your knee. That blood is more like oozing. Blood that's coming from your veins doesn't have oxygen in it. Veins go towards the heart. So because of that, that blood is going to be a lot darker and it's going to be flowing. It's not going to be squirting the way arterial blood is. And the reason why the arterial blood is squirting is because that's the one that's coming from the heart. And it's bright red and it's full of oxygen after passing the pulmonary and respiratory system. So all three forms of bleeding can harm your patient, but the most dangerous one is the arterial bleeding. Arterial bleeding is the one that can kill you the fastest. So no matter which type of bleeding you have, the first thing you do is apply direct pressure with a gauze. As you see here, elevate the extremity to have gravity work on your favor. So once you apply direct pressure and the bleeding stops, you stop. There's no need to progress into using more invasive things because the body has the ability to create clots within itself to be able to stop the bleeding. So once you put the gauze on, don't remove it because there's clots attached to the gauze. And if you remove the gauze, then the bleeding may restart. For the majority of the population, this will help and it'll be enough. If your patient's on blood thinners, if your patient's having a blood disorder, if they have a big artery or vein that's been cut or has some kind of injury, it's going to be a lot harder for you to control the bleeding with just a gauze and direct pressure. And this is where people make mistakes because they hesitate. They put one gauze and think that'll be enough. You got to stack gauze on top of gauze on top of gauze. And if the blood keeps going through the gauze, the roller gauze, the 4x4, then you got to escalate onto a tourniquet. And you better act fast because a person can die within seconds. So when you apply the tourniquet, don't waste time measuring. Just go high and tight. I remember I had a patient who fell on the tracks and got their foot amputated, squirting out arterial blood from their leg. They lost their foot. And what did we do? Right away, we didn't spend time measuring. We didn't spend time guessing on what to do. We grabbed the tourniquet, applied the tourniquet, we removed the slack and put it really, really tight. And then after putting it really tight, then you twist. After twisting, you twist till you can't no more, and then you lock it in place. After you lock it in place, the next thing you need to do is document the time that the tourniquet was applied. If that one tourniquet is not enough to control the bleeding, then what you do is get a second tourniquet and apply it immediately on top of the first tourniquet and apply it the same way you did the first one. Make sure that it's very, very tight. And I want to let you know that just because the person may lose the limb, it doesn't mean that you have a contraindication for the application of the tourniquet because it's life over limb. It's better to be alive, missing a foot, for example, than being dead with both legs. Now, in this demonstration, I'm putting on a tourniquet for the brachial artery. But imagine this is in the leg. Imagine this is the femoral artery inside of your inner thigh. Imagine the person has deep vein thrombosis and they hit their foot against the refrigerator, or they hit their leg and now they can't stop bleeding with blood thinners like warfarin or heparin. Imagine the trauma was a stab wound or machete wound to the femoral artery or a gunshot wound that landed right on the femoral artery. These people can lose from 500 to 1,000 cc's of blood per minute. So that's why I said at the beginning, you don't have minutes, you have seconds. For the majority of people, 6 or 7 liters of blood. But you don't have to wait 6 or 7 minutes to go dry. You'll die before you're dry. What I mean is if you lose 1 to 3 liters of blood, that may not be compatible with life. So you need to act very, very fast because if a person has an injury to their femoral artery, they're going to die a lot sooner than later because of the rapid blood loss. And just so you can know, the way you treat the femoral blood loss is the same way I did with the arm. Same principles apply, high and tight, take away the slack, go ahead and twist until you can't no more, lock it into place, document the time, and transport the patient to the nearest appropriate facility as soon as possible. And the appropriate facility is a trauma hospital, ideally. Why? Because a trauma hospital has trauma surgeons. These people have been training to be trauma surgeons for 7, 8+ years. They're a doctor, but you don't want to send this person to the wrong doctor because there's nothing a dermatologist can do for this patient. But a trauma surgeon is much better trained and much better equipped inside of the operating room. I want to remind you guys, trauma is a surgical disease, which means that it gets treated at the operating room. Try your best to do everything you're doing within or in less than 10 minutes and get the patient to the hospital as soon as possible. Real scenes are messy. Scenes where there's amputations are very chaotic. You could expect firefighters, you could expect police officers, you could expect family members. There's going to be a lot of emotions flying, and you got to try your best to stay calm. I know it's easier said than done, but the best way to stay calm is to be familiar with your protocols, be familiar with the equipment in the back of your ambulance, because if you stay ready, you don't have to get ready. Here are the most common mistakes people do when trying to control bleeding. 1, they are not pressing hard enough. 2, they're waiting too long. There's too much gauze being soaked up by blood before they even think about applying a tourniquet. 3, the tourniquet is too loose. 4, they place the tourniquet too low. 5, not reassessing to see if the tourniquet or the bleeding control is actually effective. Most people worry about losing the limb, but without bleeding control, you'll lose the patient.